Hello, compassionate future nurses. Welcome once again to NCLEX, where every lesson transforms you into a confident, capable, and caring professional. We upload 2 to 3 advanced NCLEX videos every single day, each one packed with clinical insights, real-world reasoning, and Stancoast pearls that bridge knowledge with nursing practice. In today's powerful and highly relevant session, we are addressing a topic that combines nursing skill, crisis management, and humanitarian care, nursing care of clients who are victims of terrorist agents. In this critical lesson, we will discuss how to recognize and manage chemical, biological, radiologic, and nuclear exposures, often abbreviated as CBRN. You will learn the priority nursing actions in mass casualty events, including decontamination procedures, isolation precautions, triage principles, and the use of personal protective equipment. We will also explore psychological support, teamwork, and communication strategies vital for maintaining calm and safety during chaos. So, stay tuned and focused, because this session is not only about saving lives, but also about staying prepared when the world needs nurses the most. And remember, at NCLEX, we do not just train nurses, we prepare frontline heroes ready to respond with courage, skill, and compassion. Let's begin this vital session on caring for victims of terrorist agents. Before we dive into today's lesson, let me take a moment to guide you towards something truly valuable.
If your goal is to pass the NCLEX in just 1 week or 1 month, then the fastest and most effective way is to enroll in our complete online NCLEX review crash course. This course is a one-stop solution, a reliable shortcut, and a proven method with a solid 99% passing rate. More than 5,000 students have successfully passed the NCLEX by using this course. Here's exactly what you'll get. 100-hour mini crash course perfect for those who want to pass within a week. 300-hour comprehensive lectures covering 300 essential NCLEX topics that are commonly tested. 5,000 real NCLEX questions. Prepare with real exam questions and eliminate surprises. 15 full practice tests, including CAT simulations, simulate the real exam for a stress-free experience. Exclusive ebook plus 1-year access. Study whenever and wherever you want. Seats are filling up quickly. Enroll now to save 70%. Visit our website to enroll in our complete crash course.
Let us now move into a high-stakes emergency scenario that demands sharp clinical reasoning and rapid recognition skills. While attending a crowded indoor event, several individuals suddenly develop shortness of breath, excessive tearing, coughing, and a burning sensation in their eyes and throats. Emergency responders quickly arrive on the scene, suspecting a terrorist-related chemical or biological attack. The victims are transported urgently to the emergency department for triage and stabilization. Now comes the critical question: which agents should the nurse suspect as the most likely cause of these acute symptoms? Here are the options to consider carefully. Option 1, anthrax. Option 2, sarin gas. Option 3, smallpox. Option 4, radiation option. 5, cyanide. Option 6, Ebola virus. The correct answers are Option 1, anthrax, Option 2, sarin gas, and Option 5, cyanide. Transitioning into the expanded rationale, in cases of suspected bioterrorism or chemical exposure, the nurse's first and most important role is rapid recognition of the pattern of symptom onset. The sudden development of respiratory distress, tearing, and mucosal burning indicates exposure to a chemical agent, though a biological agent such as inhalational anthrax may also be involved due to its aerosolized potential. Beginning with anthrax, it is caused by Bacillus anthracis, a spore-forming bacterium that can be weaponized in aerosol form. Inhalational anthrax initially mimics a mild upper respiratory infection, producing sore throat, fever, and malaise. However, it rapidly progresses to respiratory failure, cyanosis, and shock, often with mediastinal widening visible on chest X-ray. Without early administration of antibiotics such as ciprofloxacin or doxycycline, mortality is extremely high. Nurses must initiate airborne and standard precautions, wear full personal protective equipment, PPE, and immediately report to public health authorities. Next, let us shift focus to sarin gas, an extremely potent organophosphate nerve agent. It acts by inhibiting the enzyme acetylcholinesterase, causing an accumulation of acetylcholine at nerve endings. This leads to a cholinergic crisis marked by meiosis, pinpoint pupils, bronchorrhea, increased secretions, bradycardia, and respiratory paralysis. Victims often describe a terrifying sensation of being unable to breathe. The nurse's priorities include decontamination, remove contaminated clothing, wash skin with copious water and soap, airway management, and administration of antidotes, atropine and pralidoxim, 2 p.a.m. It is vital that staff avoid secondary contamination by wearing protective gear and handling victims cautiously. Continuing onward, cyanide is another deadly agent that causes cellular asphyxiation by binding to cytochrome oxidase, preventing oxygen use at the cellular level despite normal oxygen supply. The result is tissue hypoxia with bright red skin, dyspnea, restlessness, and sometimes a faint odor of bitter almonds. Oxygen saturation may appear deceptively normal because the cells cannot utilize oxygen. The nurse must deliver 100% oxygen and prepare amyl nitrite or sodium nitrite followed by sodium thiosulfate as antidotes. Cardiac and respiratory monitoring are critical because arrest can occur within minutes. By contrast, smallpox and Ebola virus are biological agents with delayed onset of systemic symptoms such as fever, rash, and hemorrhage. These diseases do not cause the acute tearing or choking observed here. Similarly, radiation exposure primarily leads to nausea, vomiting, bone marrow suppression, and skin burns rather than immediate respiratory or ocular irritation. Now, before we wrap up this scenario, let us pause for a vital reflection with the Stan Coast clinical insight. Recognizing the speed of symptom onset is the nurse's first diagnostic weapon. Sudden, simultaneous respiratory distress in multiple people usually signals a chemical agent, whereas delayed systemic illness over days points toward a biological threat. And moving forward to the Stan Coast high-yield NCLEX Pearl, your quick memory booster for exam success. Anthrax, inhalational exposure, flu-like prodrome, rapid respiratory collapse. Sarin gas, nerve agent, meiosis, bronchorrhea, paralysis, treat with atropine plus pralidoxim. Cyanide, cellular asphyxiant, bright red skin, rapid death, treat with nitrites and thiosulfate. Smallpox/Ebola, delayed rash or hemorrhage, not immediate airway symptoms. Radiation, dose-dependent gastrointestinal and hematologic effects. No acute tearing or choking. Finally, let us conclude with an essential clinical prioritization tip. During mass casualty incidents, nurses must rapidly triage, decontaminate, and protect themselves first with level C PPE, including an air-purifying respirator, chemical-resistant suit, gloves, and boots. The nurse's awareness of each agent's mechanism of action and treatment protocol can determine not only patient survival, but also the safety of the entire healthcare team. Thank you for watching. We will see you soon in next video.
If your goal is to pass the NCLEX in just 1 week or 1 month, then the fastest and most effective way is to enroll in our complete online NCLEX review crash course. This course is a one-stop solution, a reliable shortcut, and a proven method with a solid 99% passing rate. More than 5,000 students have successfully passed the NCLEX by using this course. Here's exactly what you'll get. 100-hour mini crash course perfect for those who want to pass within a week. 300-hour comprehensive lectures covering 300 essential NCLEX topics that are commonly tested. 5,000 real NCLEX questions. Prepare with real exam questions and eliminate surprises. 15 full practice tests, including CAT simulations, simulate the real exam for a stress-free experience. Exclusive ebook plus 1-year access. Study whenever and wherever you want. Seats are filling up quickly. Enroll now to save 70%. Visit our website to enroll in our complete crash course.